A medical case that could potentially affect thousands of Americans who've gone in for surgery. The case involves replacement hips that have gone bad. And now come questions about whether the maker of those hips knew there was a good chance there would be trouble. Here tonight, ABC's medical editor, Dr. Richard Besser.
3 years after Dennis Brooks had his arthritic hip replaced, he began to feel the pain. It became so bad that he just had his hip replacement replaced.
I was depressed. They got to go through this again because, as far as I was concerned, they didn't do their research.
Brooks' original hip replacement was made entirely of metal, and that appears to have been the problem. Something his new surgeon, Dr. Steve Harwin, says he sees all too often.
I've never been an advocate of metal-on-metal hips. I was skeptical about some of the results when we had these early reports of failure.
Hip replacements are a great medical success story. Versions made of ceramic and plastic. But some new artificial hips are entirely metal. And for the estimated 500,000 Americans who now have metal-on-metal hips, the news hasn't been good. Johnson & Johnson recalled their all-metal hip in 2010. A deposition revealed a 2011 internal company document predicted that almost 40% of those hips would go bad within 5 years. Johnson & Johnson says that estimate was based on a small, limited set of data and shouldn't be generalized. But the New York Times reports that lawyers for the patient now suing the company introduced internal documents in court showing that Johnson & Johnson knew of the problems with the hip all the way back in 2007. The failure rate for all brands of metal hips varies. It happens more often in women and the overweight. It's believed that constant friction can cause metal to break off into your body, even end up in your bloodstream. That can mean joint pain and swelling, and symptoms you'd never associate with your hip, including rash, heart problems, fatigue, depression, problems with seeing or hearing.
Those are some serious symptoms, but Rich, there are thousands of Americans walking around with this metal in their hip right now. What if they're not feeling any of these symptoms at all? What do you do?
Well, even if you're not having any problem, every 1 to 2 years, see your doctor and get checked out. But, as you see, the symptoms are very strange. So any change in your health and you have one of these hips in, be seen right away.
And for those who are watching tonight and have hip surgery weeks or months away, what do they do?
Well, the good news, they're not using these metal-on-metal hips anymore. You can go in with confidence.
All right, Rich Besser, I know you'll stay on the case, Rich. Our thanks to you.